brief presentation on the Center for Universal Health Coverage. Why CUHC? Now, as you are aware, the scheme has been in operation. The National Health Insurance Scheme has been in operation for a little over 10 years now. And a lot of expertise and experience have been built over the years. And people have come from far and wide, like you have come, to share in our experiences, both the positives and the negatives. The good thing about sharing positives is that then if you are stepping on that line, you know that it's probably going to be, yield good results. The good thing about knowing about the negatives or the challenges is that then you know you don't go that way, or as much as possible, if you are going that way, you use another route to go there. So there has been a lot of experience, there has been a lot of expertise built within the scheme and indeed outside the scheme. So, however, there's not been any formal mechanism for sharing. People just write and come to the health insurance, and, they are checking through some of the things. So it became obvious that it is important, as we want to share with sister African countries, with other low and maybe middle-income countries, that we have a very formalized thing, so that the sharing will be more systematic. And the establishment of the Center for Universal Health Coverage. The center has been set up as an intellectual leadership technical training center to facilitate health financing, health policy reforms, and the development of health insurance systems in Ghana and other African countries, and possibly other low-income countries. It's a collaboration between the National Health Insurance Authority and University of Professional Studies, Accra, and it is housed on the campus of University of Professional Studies, Accra. The vision is to be a global center of excellence in universal health coverage with a focus on education, research, and consultancy. So these are the three main goals, aims, focus areas for the center: education, research, and consultancy. The mission is to generate knowledge and develop competencies towards improving global healthcare financing. People may want to enter the health insurance industry, and it's important that they do have a little background about the theories and the ins and outs of health insurance. So we believe that this will help to develop the competencies. And also within the scheme, or within a scheme, a financing scheme, there may be certain systems where you need capacity or competence development. For instance, we are talking about maybe Namibia has set up a scheme and they want some insight into deeper insight with experience backing it into claims management. We could, for instance, offer assistance in that area. So the key program: competence development, evidence generation, and technical assistance, education, research, consultancy. You could have maybe a country or a scheme or a group of people or students identify that they need competencies or skills in a certain specific area of health insurance. For instance, provider payment systems. Then they could ask for the center to give them some training in these areas. As I said, a lot of expertise has been built within and outside the scheme over the years. Then practical training sessions, such as sending people on site to look at things like membership registration. Now there's a rollout of registration, biometric registration of members across the country now. So maybe going to the scheme, you would be exposed to how the ins and outs of such a process. So that's what we are calling practical training sessions. Maybe it's to do with claims management. So you see a center and how they're actually doing the management. Evidence generation. The center will undertake research on UHC or health insurance. Over the years we have generated a lot of very, very useful data within this system. Plenty of data. Talk about membership, demographics of the membership, claims, utilization, disease patterns. There is a lot of data out there, but sometimes when you are engaged on the job, there's so much to do that you do not have time to go and look at big data. So that if, for instance, healthcare financing or a health economic student wants to do their research, you can encourage them to do the research with some of our data and support them in the research. So you can help with one, developing the scheme from scratch, two, with evaluating certain aspects of the scheme or the whole scheme, or helping strengthen particular aspects of it. Is it the benefit package? Is it the provider payment mechanism? Is it claims management? Is it fund management? With whatever it is, we are able to do this.
Health economist Mr. Weke to give a more detailed view of what we expect. Just briefly, that we are here a multi-sectoral committee from various ministries and from the private sector, basically headed by the Social Security Commission, which is the government agency that has been mandated to drive the universal health coverage agenda in Namibia. So basically we are here to learn from Ghana's experience with regard to universal health coverage and to see what lessons we can draw for our own situation for determining the roadmap towards universal health coverage in Namibia. So with that said, my name is Kons Karamata from Social Security Commission. I will allow my colleague to go into more detail.
So Namibia currently has about 60% of its population is covered by health insurance.
60%?
15 to 60.
Oh, okay.
So we want to expand the coverage. So the government is trying to learn from experience of other countries which are somehow successful in terms of population coverage and financial protection. And we want to learn more about the design issues, and how we should design the benefit package, and how we should finance the schemes, and what would be, a good combination of financing, contribution from members or other forms of financing. And we want also to learn more about service delivery in terms of the partnership between private and public, and in terms of provider payment mechanism, and resolving shortcomings and other benefits of it, and the governance structure, and how we are administering the different schemes. And operational issues, the ones that you have been mentioning on claim processing, registering, collection of contributions. All these operational things are really vital to us, in addition to the design of the schemes. So we will be focusing on the design, because we are going to design which can carry most of the operation. And also the implementation issues are also very important. Also, we are not in the implementation phase, but we need to be aware of those issues.
I'd love to see how you would approach a massive task of introducing universal health. As you heard, less than 16-17% of our population has got access to healthcare insurance. So the whole phasing approach, and also to see how you actually reform, over time to actually cover that. That's one of the major tasks. I would love to understand the interrelationship between your reference to universal health and health insurance, to see how that differs and how that actually complements each other. And then I think the last one is also the partnership between public and private. How it can actually be supportive and complementary in achieving a national goal.
What you said about the expectation, I wanted just to add now the role of trade unions and civil society in policy making process.
With the coming of independence, the first president of Ghana declared health as free for everybody in the country. But subsequent governments continue to think through how to finance the healthcare services. So because of the hardships that the health sector was facing, user fees, as we popularly call in Ghana here as cash and carry, was also introduced. And this, in fact, if you like, was a stumbling block to a lot of people so far as access to healthcare services was concerned. So people try to find ways of getting over this problem. So in the 1990s, community-based health insurance schemes started springing up. In fact, we can recall the first one that was around 1992 in a community called Nkoranza, and we described that place as the maker of health insurance. And by the time that Ghana introduced formally, officially, legislated national health insurance scheme, over 160 community-based schemes had been established across over 60 communities. So in 2003, we legislated and got the national health insurance scheme established. In 2008, the government decided to add on to the benefit package by introducing free maternal care policy and then decoupling children from their parents. Our civil society organization realized that that was not fair, because the children also have their own rights. So pressure mounted, and by 2008, children were decoupled from their parents. So if your parent is not registered, it doesn't mean you cannot be registered. In 2012, the act that established the National Health Insurance, which was Act 650, was revised to Act 852. Here we want to show the private sector contribution to the process of establishing a national health insurance scheme in the country. So far back in 2009, we had a scheme called Nationwide Mutual Health Insurance, medical insurance. In 1997, Metropolitan Health Insurance Plan was also there. And in 1999, the Ghana Healthcare Company, which is the Social Security, also attempted to establish one. By the time the insurance was introduced in 2003, the ideas were still at the gestation period and had not moved into operation. And ahead of civil society organization, we had Civil Servants Association. They also had their own scheme. They were operating before the National Health Insurance Scheme. So all these things served as fertile grounds for Ghana to introduce the National Health Insurance, because people had at least had some experience in one way or the other with insurance, be it mutual or private. These are the processes that went through in getting the insurance in place. In fact, an interministerial task team was established by government, and the Ministry of Health was leading this team. In fact, these actors, Ministry of Finance, local government, information, employment and social welfare, were all debating which of these ministries should handle the health insurance. The one agreement was that this is all about bringing together all the monies that we have to finance the healthcare service. So is it not legitimate to put it under finance? And then the Minister of Health also said that, well, you are bringing the money, but it's all about health. So why don't we lead it? And then local government, Dr. Trump mentioned the time when we have district mutual health insurance scheme. This was a decentralized system that was given to the local government system to help operate. And so the local government was also a key actor there. And then it's also all about information, because you have a product you want to sell. So you need a Ministry of Information to design communication strategies that will appeal to the people to buy the product. And then we were also placing emphasis on the poor and the vulnerable. So if it comes to the poor and the vulnerable, then the then Ministry of Employment and Social Welfare, now we've changed it to Ministry of Gender and Social Protection. Yeah. So the task team was led by a national coordinator, and then we had sub-task teams. One was in charge of the scheme design. One was also in charge of the benefit package development. We also had a team that was in charge of actuarial projections and calculations, because we are talking about money. And then one was also in charge of publicity. So all these groups were doing their work alongside each other. And then at the end of the day, all their reports were pulled together. Now we have National Health Insurance Authority. But in 2003, we had what we call National Health Insurance Council. It was appointed to oversee the operations. And then the first chief executive at that time was called the executive secretary, was appointed. And then formal recruitment at the district level also started in 2004. And in the same year, 2004, we had an official launch, the national launch of the scheme.